Hi, folks, and welcome to Sparkles for Better Mental Health Growth in Five Dimensions. And today I'm extremely happy to have a new friend of mine, Dr. Greg Dennis, on the show. Hello, and you're from Oklahoma in the States.
Yes, ma'am. Yes, thank you for having me.
I'm very happy to have you. Now, tell me a little bit about yourself. I know you're practicing as a physician in Oklahoma. How did you get
Mhm.
to become the person you are today?
Yeah. Well, so yes, I'm a family practice physician in Oklahoma, as you mentioned, and along with my wife, we have a practice called direct primary care. So, for those not familiar with that, direct primary care is where we've gotten away from the insurance model, which is kind of corrupt. That's a whole nother topic, but and so we just people pay a monthly membership, and so with that they can see us as much as they want. Basically, they can text us, message us, and when you get away from the insurance, then you're free to kind of practice how you see fit. And I've found since doing this style of practice that when you take all the middle people out, it's actually not that expensive. You can get MRIs for really cheap. You can get labs for really cheap, and so that's been kind of cool. But when you're, not under the corporate medicine umbrella, if you will, and the insurance, then you can really practice to make people well and really get to the root problem, and we have a lot more time with patients. And so that's what the direct primary care model is. And then I would say, um I'll go a step beyond that, and we really try to practice wellness based medicine, which is once again trying to get to the root cause, and instead of just throwing medicine at them like conventional medicine does, we try to get them off medicine. Now, I'm not anti-medicine, but it's hard to optimize one's health, which is what we really strive to do when people are on, a dozen different medications. And so I practiced in the corporate medicine world for many, many years. I had a huge practice and practiced what I call evidence-based medicine, which is kind of a scam in and of itself. And I was lucky because one day I just kind of had this epiphany that my patients weren't getting any better, even though I was doing everything in the standard of care. So if they had high cholesterol, I was putting them on cholesterol medicine, and I was throwing all these medications at them for their diabetes. And so on paper, they looked good. Their cholesterol was low, their blood sugar looked good, but they were still overweight. They had arthritis. They were miserable. They were still dying of heart disease. They were still having stroke. They were having all these chronic illnesses, and they weren't well. And so one day I just thought, there's got to be a better way. And so I went on this kind of deep dive and just really started learning on my own. I've always been into fitness and health and wellness, but I never really practiced medicine that way because that's not how I was taught. And so I went on this deep dive, and the more I kept learning, the more I was like, well, that's not what I was taught. And so I started implementing some things when I was still in corporate medicine and realized that I could actually heal people. I could actually, in many cases, reverse type 2 diabetes. And nobody ever told me that. And so the more I kept going, into that, it was not, it wasn't a very good fit to be in that setting anymore. And so I joined my wife in what we're doing now in a clinic that's called Vibrant Life Direct Care. And we just opened our second location here in Oklahoma. So
Wow, that's gorgeous. And I love the way you said that, how you slowly just found out that really what conventional medicine does is mostly putting band-aid fixes on in the form of medication.
mhm,
And if it
for
is
sure.
not good enough, they throw a second medication on it instead of at least offering the patients some lifestyle options with the and giving them the hope that if they implement it, actually they can reverse diabetes.
Hmm.
And not just that, they can get their sparkle back, as I say. They can get their mental health back, and they
Yeah.
don't need all those drugs that they supposedly do. And I find it very obvious in the mental health field. What's your experience with that?
Yeah. Well, for sure. I mentioned, diabetes as an example, but
Mm,
you could take mental health, you could take in many autoimmune diseases. I mean, there's a lot of these chronic type illnesses that conventional medicine just doesn't have a good answer to, and just again throws medication at them. And then, as you mentioned, if it doesn't work, you throw a second and a third medication. And so uh, now, it's this what I refer to as a sick model of healthcare. I mean, so it's just these patients are in this vicious cycle. So now not only are they not better with their mental health or their diabetes or whatever, well, now they're on 5 or 6 medications and probably having some side effects from those medications. And so their chronic condition is not any better or worse. And now you have all these compounding effects from the medications. And so their life is just miserable. And that's when we get a lot of people, they're fed up with the, with the traditional system, and they'll find us and they're like, I've been doing this for years and years. I'm on the sack full of medication and I'm not any better. Like, I feel like crap. And so we'll get somebody in there or in here, and we'll start working with them to really try to figure out the root cause. And most of the time it all goes back to lifestyle, a lot of it. I mean, and things for your mental health, which is kind of your specialty, or their diet and their sleep patterns, and their physical activity and all those things. And it's unfortunate that conventional medicine doesn't even recognize any of that. And I guess probably because there's no money in that. Unfortunately, I think it all comes back to that. So
money for whom is a question, and we both know for whom the money is supposed to go, because it's the pharmaceutical industry and the
absolutely.
agroceutical industry, and those make the big money, and they steer the politics, and it is
with
very obvious to many people now, and that's the one that come to people like yourself and me, because
Without a
they're
doubt.
fed up, literally fed up with the food that they get,
Yeah.
because it's not really fake, it's fake food
Yeah. And
now.
and now that I'm on this side of it, looking back, I'm
Mhm.
like, how I mean, I'm fortunate that I was able to now see it for what it is, but I'm surprised that more doctors, I mean, because these are educated people, and they're good meaning people. I mean,
Mhm.
I still got a lot of friends that practice kind of conventional medicine, but I'm surprised that more people don't see it for what it is, because most of the time with conventional medicine, especially as it pertains to chronic disease, that people don't get better. And now medicine does great for acute stuff and for trauma and things like that, but for the treatment and certainly prevention of chronic disease, it does nothing, and many times makes things worse. And so I'm really surprised that more uh, doctors
Mhm.
just don't see that.
That's a good point. What's your idea why that is? Do you have any?
I think it's just because that's the way they're taught. And when you come up in a medical system, and as a young person not knowing anything, and then you look up to these faculty members who are really smart, and they tell you this is the way it is, and this is evidence-based medicine, and you don't question it, and if you question it, then you're a quack. And so we just it's almost a brainwashing. I'll be real honest. It's almost a
Yeah,
brainwashing. And again, I think these are good-willed people, but
yeah,
so we come up in the system kind of brainwashed to do this, and to just practice this what we call quote evidence-based medicine. And so I just think they don't know what they don't know, and they just can't see past what they've been taught, and it's been indoctrinated in them that this is the only way. And so I think that's why. And uh, again, I did it for years and years, never questioned it. And even when people would come to me and say, hey, I found this alternative treatment that I saw online, what do you think about it? And I'd just blow it off, and I would say, oh no, I practice evidence-based medicine. And so anyways, I like to tell people I'm reformed. I'm a reformed, conventional medicine doctor, because I've been able to see it for what it is. So I will say that with this recent pandemic, more people have opened their eyes, and it exposed a lot of our conventional medical system, and so people
Mm.
have a lot more distrust in it than they used to. And so, if anything good came out of the pandemic, it was that.
I couldn't agree more with that because the pandemic was very unfortunate the way it unfolded and the way the government regimented what later turned out to be a big disaster. And
Mm-hmm.
it's still not fully known how bad it really is. But that's another point. But I agree. And the sad thing is, what I see when I talk with especially middle-aged and older physicians, and some of them are my clients because they don't want to go through insurance, they're afraid that somebody will find out what's going on and then they lose their license. So then if they need the income, the licensing for physicians is quite a secure way to make money. And it's a big hurdle to throw out your license when you do what they call still alternative medicine
Mm-hmm.
and go into the private system. And it can be quite a deterrent for physicians. And I think that the physician burnouts that we are seeing, the increasing, is not so much a work overload. I think it is this mental conflict between
Mm-hmm.
what they experience as value, they want to help their clients, and the conflict between what their regulators force them to say and do if they
Yeah.
want to keep their license. That's a chronic conflict. And we know that
Mm-hmm.
those chronic conflicts are mentally so stressful that they can cause depression and burnout.
Yeah. For sure. Like I said, I think most people in this field are good-willed, and they
Yes.
want to do best, even though they may still trust the conventional treatments.
Oh, yeah.
But most of them, again, want to do best by their patients. But you're right, when they're in the corporate setting, many times their hands are tied, and it's unfortunately it's not getting better. It's getting worse. I was in it for almost 15 years, and just in that what I call short amount of time, it changed so much. And even I've been out of it for about 2 years, a little over 2 years now, and just kind of keeping in touch with people, talking to people. It's even worse now than it was 2 years ago when I left.
Mm.
And so unfortunately it's not getting any better.
I mean, I still remember in the 80s, I'm an older adult, I'm 61, but I love longevity medicine. So I'm all with you there because as an older adult, I want to stay healthy as long as I can. Of course, I mean, there's no way the body will eventually break down and we will die, and that's fine. But I don't want to end up demented in a nursing home, and we know we can
For
prevent
sure.
it. And you do a lot of strategies to do that. What strategies do you use in your practice to uh, help alleviate or heal chronic illness?
Yeah. Yeah. So we're anti-aging physicians, as you mentioned. And so there's a lot of parts to that. Most of them, again, it comes back to lifestyle. You clean up one's diet. I mean, it's getting out the processed foods, and eat real whole foods, and try to most people are, especially here in the Midwest, we have a lot of people that are overweight, and so, or morbidly obese, and so working with somebody on their weight, and other things we like to do is optimize hormones. We feel like that's an important piece
Yes.
in longevity, for men and women. um, and we certain supplements, now that's individualized depending on their needs, and where they're at. And so you just kind of hit multiple aspects to do everything you can to help them to live a longer life, and ultimately we want to improve their health span, not just their lifespan, because what good is it to live to be 100 if you're going to be disabled for 20 years of that? And so I tell people we want to improve their health span so they're healthy and vibrant. And so I think we focus on decreasing risk factors for the the big ones, which are cardiovascular disease, diabetes, Alzheimer's disease, those kinds of things, because the cancer, and that those are the, the big killers. And so if we can decrease risk factors for those, then that's important in, as far as longevity and stuff as well.
Oh, that's a good point, especially the way that you work. And what do you consider the main risk factors for those diseases? And I'm pretty sure it's not the same that a conventional medical doctor would say.
Yeah. So first thing that comes to mind is going to be what I refer to as metabolic health. And I think metabolic health is kind of a big term, but it's how well, we process our calories and glucose and, things like that. And most people, at least around here, are very metabolically unhealthy. And because, again, the foods we eat, the lifestyle that we live, and they're stressed all the time. I mean, there's a lot of, pieces to that, but metabolically unhealthy people are going to obviously be at increased risk for diabetes, which puts you at risk for all kinds of things. It's going to put you at increased risk for cardiovascular disease, and Alzheimer's disease, has some people refer to as type 3 diabetes, because it's been linked to the elevated insulin and insulin resistance, and so that's the first thing that comes to mind. Again, there's a lot of things we could talk about, but metabolic health would be the first thing I would tackle.
Yeah, that's a really good point. And for chronic illness, I love the image that Dr. Brighten puts in his book, The End of Alzheimer's, of the leaking roof. He said, if your roof has 36 holes, it's not enough to just plug one. You have to find and then plug one after the other until the roof is fixed, or put a new roof on it. And it's really what we do as functional natural health providers, that we fix all holes that we can find, not
Sure.
just one, and put a Band-Aid on it.
For sure. Yeah. There's definitely multiple things, and obviously it's going to be individualized, depending on, the patient's history and, and their, all kinds of things.
So let's just assume that somebody's listening to that, just like myself, an older lady, 61, wants to stay healthy and well up to 100 or whatever. And I would come to you and say, Greg or Dr. Dennis, what can you do for me? How can you help me? What would you say? What would you do?
Yep. Well, first, I always start out getting some blood work on somebody, and I usually will do my own, just because I get I don't get crazy things. Some functional medicine doctors get $1,000 worth of lab, and that's okay. That may be warranted in certain situations, but I mean, we get mostly basic stuff. But what I'm looking at is, again, your metabolic health, and I check that through a fasting insulin level, as well as I do like looking at lipid panels. I look at it a little differently than most, but I'm looking at HDL cholesterol and triglycerides. And I'm going to look at hormone levels. I'm going to look at vitamin D levels. And so I look at all those things. And so I'm going to, once I get all those lab results back, then I'm going to teach them how to improve their metabolic health. And that's through changing their diet up a little bit, in many cases changing it up a lot, maybe some intermittent fasting, and get moving, exercise. I really focus on, well, and especially for women, is building, or at least maintaining, muscle. I feel like muscle is sometimes not talked about enough. And I feel like muscle is very important for longevity, and also for, again, metabolic health. And so, unfortunately, nature works against us in that, something called sarcopenia, which is the loss of muscle as we age. And so, we really need to prioritize muscle. So I talk about that and how to do that, which is hormone optimization, prioritize protein, and then you got to work the muscles through exercise. And so we talk about all that. So I'm going to want to optimize your vitamin D levels, and I'm going to want to optimize your hormone levels. That could be thyroid, and that most likely in a 60-year-old woman, that's going to be other the sex hormones, estrogen, progesterone, testosterone, which I'm a big advocate of what we call hormone optimization.
Yeah.
We use bioidentical hormones. I am not a fan of the estradiol and Premarin and those oral medications, but we like bioidentical hormones. And so if somebody is going to a practitioner that is trained in that, and really hormone replacement therapy, in my opinion, is an art. And so you really want to find somebody that kind of knows what they're doing and will work with you. But I would want to optimize hormones, because not only is that going to help with longevity, to decrease risk of osteoporosis, decrease risk of Alzheimer's disease, again, be able to help maintain muscle, but it also makes you feel better. When you have your hormones optimized, then you're going to have more energy, you're going to sleep better, you're just going to focus more, your libido is going to be improved. So it really improves all aspects and quality of life.
Oh, that's amazing. So I think that those are all very valid options. And that's just a small fraction of what you do in your practice. So if somebody really likes what you do, how can they find you? How can they contact you?
Yeah, probably the best way is through our website. It's Vibrant Life DC, which stands for Vibrant Life Direct Care.com. And then, it talks all about our services and what we do. And then also my podcast is on there. And I have a podcast called Fit RX. And I didn't talk about that, but kind of, as I was learning, doing this deep dive, and learning all this stuff on my own about health and wellness and longevity, and I read all this stuff, and I couldn't get enough of it. And I thought, well, gosh, I'm just going to start a podcast and, start talking about all this stuff, that I've learned. And so anyway, that's what I did a little over 2 years ago. So
I looked at the podcast, and sorry, I didn't mention it, but it's a great one. And I listened to a few episodes, and you share very important information. So I recommend that to all. And I will put the links to it underneath too.
Yeah. Well, thank you. Yeah. Thank you for that. So,
of course, I love podcasting. I do my own because I love sharing stories, and every podcast is different. So it is fascinating. And I love sharing podcast episodes from fellow practitioners that do really good work like you do.
Yeah. Yeah. Thank you. Yeah.
So what's your website to send people to?
Yep. VibrantLifeDC.com.
That is easy to remember. I'll also put that underneath your video and in the audio file note. And that's it for today. I thank you very much for being on my show today.
It's my pleasure. Thank you for having me.
This marks the end of this episode of Sparkles for Mental Health Growth in 5 Dimensions. Make sure to subscribe to the show and tune in to the next episode. Bye-bye. When you combine modern science, ancient wisdom, nature, experience, and love, magic happens. I'm Dr. Christine Sauer, physician, naturopath, coach, human. It feels like magic to my clients, and their lives are transformed through the skills combination of natural and human sciences, ancient philosophies, and caring human-to-human interaction. Discover this kind of modern wizardry, and let's prepare powerful healing potions together. Come and enter our wonderful world of wellness.